Thank you. It's both a pleasure and a real honor to be here today amongst many of you who've made this issue an important issue on the front line, on the front burner for so many people, both here and abroad, both in the scientific arena and the courts, et cetera. So I really appreciate the opportunity of coming here today and really giving you what is a ceremonial kind of a communication. I want to share with you the position of the World Health Organization, then a little further on some of the international organizations involved in this issue and struggle. I am speaking here today for Maritza Tennessee. Dr. Tennessee is the Pan American Health Organization's Director of Occupational Health, part of their Department of Environment and Health. And she's sorry she's not able to be here today. I come from the University of Illinois, and we are a World Health Organization collaborating center in occupational and environmental safety and health, and that's my hat that I was asked to bring to you. The initial slides that I'm going to show you this morning are from Dr. Ivan Ivanov, and based on a presentation that he gave in March. Dr. Ivanov is from the WHO Center headquarters in Geneva in their occupational health section. So let me begin as a background to indicate that WHO has been involved in this issue for a period of years with increasing attention over the last 4 or 5 years. And actually, starting at the bottom of this slide and coming back up, we understand WHO indicates that they see asbestos as the most important occupational carcinogen. Half of the deaths from occupational cancer are caused by asbestos. That in 2003, as part of a joint World Health Organization, International Labor Organization program, these two organizations had been working on issues of dust diseases of the lungs, described as silicosis and other diseases, but in 2003 they elevated asbestosis and asbestos-related diseases to be center stage within that activity on silicosis and these other diseases. In 2005, as part of the discussion at the World Health Assembly, under the issue of cancer control and prevention, the countries were urged to pay special attention for which is avoidable to cancers that have definable, avoidable exposures. And within that discussion, asbestos was highlighted. Though the WHO has not yet become more specific with respect to asbestos, and that is an issue and a struggle that remains before us. WHO agrees with you in this room that asbestos-related lung diseases include lung cancer, mesothelioma, asbestosis, pleural plaques thickening and effusions, laryngeal cancer, and other cancers, including GI and others. With respect to this, it is very clear, and WHO is very clear, that all forms of asbestos cause all forms of the cancers. Obviously, that's not an issue that needs to be said twice within this room. Most rooms, it needs to several times. Approximately 125 million people are estimated to be exposed to asbestos, and this is throughout the world. WHO estimates that approximately 90,000 people die from asbestos-related diseases yearly as part of WHO's approach to global burden of disease. This is, as you in this room know, a very rough estimate and probably a low estimate. As was said before, asbestos is the most important occupational carcinogen, and WHO estimates that it causes 54% of all deaths from occupational cancer. Obviously, as we continue to elaborate the science of identifying what are occupational carcinogens, this level may adjust somewhat. And in this area, as within the asbestos area in general, clearing away the cobwebs of common and historically established statements that are not based on documents and not based on evidence is one of the tasks that still lays before us with respect to the international burden of occupational cancer and clearing away the rather perfidious involvement of some global corporate estimates lays before us as well in that area. We know that the death toll will increase for all forms of asbestos-related cancer, and certainly the recent literature about mesothelioma and its potential peak in incidence is most instructive in this area. 1/3 of the member states of the UN and WHO still use asbestos. 23% have banned or intend to ban it. 41% have not banned but show no record of trading in it. And I will give you some more updated data at the end of the slides. 36% still use import and export asbestos and asbestos-containing materials. The largest use, underline, 90% is in asbestos cement industry in developing countries. A particular perfidious use of this chemical, especially in our knowledge today. World production and use remains relatively stable, though I'm going to show you a slide at the end indicating the countries that are increasing their production and use. To underline again, all types of asbestos are hazardous to health, and both passive and active smoking increase the risk of lung cancer from asbestos, to be underlined as well. Now, when discussing in most groups about how you handle asbestos, even in this country, as you're well aware, there's a lot of opinion out there about our ability to handle this chemical safely and to control its exposure. First, we talk about personal protection, and the picture at the lower left would indicate to us the kind of protection necessary when handling this material. That personal protection is certainly not fully protective even for the workers involved in it, but is only for the workers and not for the communities related and in and around. Therefore, it is not an effective mechanism for control of asbestos. Next, we discuss containment, and there's a lot of debate in Illinois about containment in high schools and elementary schools and other areas. It should be indicated that containment never works for all time of the life of those materials. Sure, you can contain it initially, but again, underlying that 90% used in asbestos cement, most of that asbestos is used for roofing on housing in third world and impoverished countries, and that roofing breaks down almost immediately after it's been constructed. Certainly within a very short order, you begin to have friable material in the air. The question of asbestos piping is entirely a separate issue and not a major one related to this. So containment doesn't work. Substitution, therefore, is obviously the only mechanism and the only societal strategic approach that has a possibility for protecting the workers and communities on a global level. The WHO identifies a number of fiber substitutes that are able to be used today. Their November 2005 meeting in Lyon, and the report from that meeting has a very elaborate assessment of a variety of these substitute fibers. So to summarize, WHO's opinion is that all types of asbestos cause all of the diseases we've discussed. No safe threshold level of exposure has been identified. Safer substitutes exist. Exposure of workers and other users of asbestos-containing products is extremely difficult to control, and asbestos abatement is very costly and hard to carry out in a completely safe way. Very important global consensus findings from the World Health Organization. It recommends the elimination of asbestos-related diseases. WHO, in its charter, is chartered to combat diseases, and therefore stays in that paradigm, if you will, when discussing any of these exposures. So while we talk about eliminating the exposure and a global ban, that's a little too political within the WHO confine. They identify asbestos-related diseases, and they identify the elimination of asbestos by whatever means as an important link here. Asbestos abatement, when the elimination, when elimination and usage is not possible and it's already been used. And finally, medical surveillance for people that have been exposed. And as we know today still, and was mentioned earlier, medical surveillance is not an effective means of preventing disease for most aspects of asbestos-related disease today. Though some interesting new developments, of course, in that area as well. National approaches for elimination of asbestos that are related diseases that are recommended by WHO include a whole action laundry list for variety of societal stakeholders within each country. WHO projects that in the future, they will participate in the global campaign on elimination of asbestos-related diseases. As we indicated there, that is part of a process with ILO, attempting to enlist other UN agencies not yet fully involved, to participate with both civil and business elements within society as a whole, and then what I will describe in a few minutes is a very active collaboration today that began a few years ago with the World Trade Union movement and confederation. That WHO and its staff is bringing to the World Health Assembly this year in May the Global Plan of Action on Workers' Health, which includes the concern about asbestos as a cause of death and disease in working people. That has passed a month or so ago the executive board and will now come to the World Health Assembly and in all likelihood pass this spring, which will then be another platform to move ahead on this as well as other issues. The staff will be implementing asbestos within their modules on cancer prevention that will be developed by WHO as a whole, and again, to work jointly with ILO on these issues. For those of you who want a succinct yet more comprehensive approach to WHO's thinking on this matter, there is this position paper, Elimination of Asbestos-Related Diseases, that is available in all of the UN languages and on the web. It's only a page or so, so it is eminently usable and quotable. If I might go on just for another moment to share with you some recent developments in some organizations that I've been involved with on an international level. These organizations have primarily been focused, as yours has, I know, on the question of banning in law and treaty the use and sale and mining of asbestos. The organizations have formed together a campaign beginning with the what was the International Confederation of Free Trade Unions and now is the International Confederation of Trade Unions following a merger convention last fall. This is the organization representing the union confederations in over 150 countries around the world. And I was trying to remember how many million workers, but I didn't go back to the web page. A lot of workers. As well as the International Commission on Occupational Health. This is the oldest organization of professionals in occupational health on an international basis, formed some 100 years ago. This is an exciting movement for this organization, which is heavily influenced by corporate physicians and others that have been most reticent to move ahead on asbestos, and so that this development in the last several years is really exciting and welcomed. And finally, for the World Federation of Public Health Associations, which represents public health associations in some 60 countries around the world. This was begun by the ICFTU, the trade union federations kick off for a global campaign to ban the use of asbestos. And I should say to our Canadian colleagues, I take my hat off to the building trades in Canada and the Canadian federations, despite the abysmal behavior of the Canadian government on this topic over the last several years. The Canadian Labour Federation has been fully supportive of this campaign and moved ahead, I believe both, but I'm not up on all of the internally. As you know, the question of Quebec is both an external and an internal political issue, as is asbestos related to Quebec. So, the International Commission on Occupational Health, as well as I mentioned before, some years ago, or a year and a half, 2 years ago, joined this campaign. I should say one thing which I really usually have a slide on, but got lost in this presentation, and that is much of this professional activity was originally stimulated by the Ramazzini Society and its assessment and evaluation. And again, people in this room have been very much involved in creating that assessment, and much of this has derived from that consensus document. The World Federation of Public Health Associations, as I've mentioned, in 2005, joined these others and has been involved on national levels with respect to this and other environmental. Recently, the International Society for Doctors for the Environment, ISDE, a more advocacy group, has also joined and is looking for ways to energize its chapters. This is primarily a European organization, though does have CAPE from Canada as part of it, PSR here in the States, and some activities in Latin America and Africa. And we're hopeful that this will be a more active area. I only mention all three of these because these are organizations that would be particularly open to further collaborative activities with this group or the international ban asbestos campaign, et cetera. So it's something we need to move ahead to. From the web pages and a report last month from the Union Federation, we understand now that 46 countries have banned asbestos or will do so. 69 have not banned it but are not trading or producing it. And 47 countries are now on the target hit list of the union federations as being the countries that need primary emphasis in the campaign to move them ahead. I would indicate that on the webpage of the ITUC, though it's a little hard to find, there is a country-by-country profile of the situation with asbestos in I think it's 160 or 70 countries around the world, and quite useful if one is looking for specific activities on the ground. Also in that same report, and again a little off by formatting, We look at the situation in 2000 and now in the situation in 2004 with respect to asbestos use and production. And all of these countries on the left are using more now than they used in 2000. It emphasizes, among other things, the both the developing country and those countries with economies in quote-unquote transition as primary market places for asbestos and asbestos disease. So I thank you very much for hearing me today, and I appreciate being here. Thank you again.